Today I wanted to respond to a video that was posted recently, an interview with Johana Olson Kennedy, Dr. Helen Wimberly, and a few other people discussing transgender issues. And I am incensed by how completely dishonest they are being about what gender dysphoria is and the appropriate treatment for gender dysphoria.
I think that there's a fundamental disconnect between making a recommendation to start puberty blockers in early puberty and then not add on gender affirming hormones until around 16. Danger or potential harm to their bone density.
Children as young as 8 years old are currently being put on puberty blockers. But she has concerns about this because then they're on puberty blockers until about 16, at which point they're put on cross-gender hormones. And the reason she's concerned about this is because there are some harmful effects of the puberty blockers. So rather than waiting to put children on puberty blockers, she's suggesting that instead of putting children on puberty blockers, we put them on cross-gender hormones.
That people go through puberty at around 12. That's kind of a midpoint for puberty.
She's saying that because most children go through puberty at about 12 years old, that children with gender dysphoria should be put on cross-gender hormones at the age of 12. And again, I want to point out that just because a child has gender dysphoria does not mean they're transgender. And if the only option that children and parents are given for a child who has gender dysphoria is for them to transition first socially and then medically, we're going to have children on cross-gender hormones at the age of 12 who otherwise would outgrow it if allowed to progress normally through their own puberty. What these cross-gender hormones do is they force someone's body to have secondary sex characteristics of the opposite gender. They also cause the reproductive organs of these children to atrophy and deteriorate to the point that they often have to be removed a few years after starting the cross-gender hormones.
I think gender is just inherent within the mind, and it's not something that anyone can change.
So I keep hearing these people say that gender is inherent, and yet there are people like me who were gender dysphoric through much of my childhood and outgrew it. And in fact, the majority of children will outgrow gender dysphoria if allowed to naturally progress. So if gender is inherent, how do you explain those of us who had gender dysphoria that had that gender dysphoria resolved when we hit puberty? How do you explain rapid onset gender dysphoria, where somebody has been living as their gender comfortably and then suddenly develop gender dysphoria? And how do you explain the fact that gender dysphoria can be resolved with appropriate mental health treatment? Gender dysphoria is not a medical condition. Gender dysphoria is a mental health condition.
You know, I think the argument sometimes is that you have a healthy body, why change it? Well, I think you have a healthy mind too. There's nothing about being transgender that is unhealthy. It's just gender that exists within someone's mind, and there's no need to change that. But if there's a feeling of a misalignment with someone's body, that needs to change in order to reflect someone's authentic gender.
So she actually just said that someone with gender dysphoria has a healthy mind. It's just that they're so uncomfortable with their body that they have to medically change it. That doesn't sound to me like somebody who's got a healthy mind. In any other dysphoric condition, such as anorexia or OCD, where people have discomfort with their body, we don't accept that their mind is healthy and there's something wrong with their body. We don't provide them treatments that cause their body to become dysfunctional. Instead, we acknowledge that these are mental health issues. To suggest that a gender dysphoric person's discomfort is coming because they were born in the wrong body is to reinforce this kind of self-hatred that they already have, rather than treating their mental health issue.
Well, I think if someone is challenging the intervention that the child is seeking for alignment, they're actually challenging the gender. And that can be really harmful. People know their gender, and if a kid is trying to seek understanding about what their gender is and someone's challenging that can be really distressing.
She's saying it could be really harmful for someone to challenge a child's gender. And instead, we should give the body hormones that will permanently cause it to be sterile, that will cause the reproductive organs to atrophy, and will cause secondary sex characteristics that are going to be permanent, rather than to say to a child, "Are you sure?" And these children are basing their ideas of gender on stereotypes of what they think gender is, or on messages from their family or peers or school teachers or society at large of what it means to be one gender versus the other. This woman is suggesting that rather than having a therapist try to help a child become more comfortable within themselves, that the appropriate treatment is to not hurt a child's feelings by pushing against their beliefs, but instead to provide their body with medical treatment that will cause it to be dysfunctional.
We start from the place of tell me who you are and we will believe you, and then tell us what interventions you need because of that.
There is no other medical condition that I can think of where a patient goes in and tells the doctor what the problem is and what the treatment should be. And yet these people are suggesting that children should go in and tell healthcare providers what the problem is and what medical treatment they need. Can you imagine if an anorexic child went to her doctor and said, "I know that people say that I'm thin, but I feel fat and I want a gastric bypass." And the medical doctor saying, "Oh, okay, we'll make sure to get that scheduled for you because we don't want to hurt your feelings, and because you know who you are better than we do, and because something tangible like weight, something measurable, really doesn't mean anything. What matters is how you feel."
I think that in medicine, one of the fundamental tenets is prevention. And so we have worked really hard. Let's use the example of diabetes.
As we can test for diabetes, we can test someone's blood sugar, we can test the impacts of diabetes. We have all these diagnostic criteria to determine when and what kind of medications to give someone who's diabetic. Children with gender dysphoria don't have anything that we can quantify. They have feelings and discomfort related to whether or not they feel like they meet the stereotypes of the gender of the sex they were born. These are feelings. There's no way to test for gender dysphoria.
Right? We actually don't wait for someone to be in DKA before we think about or move forward with treatment for diabetes. It's similar across a lot of entities in medicine. It's why we practice and do screening. We don't wait for someone to be really sick before we intervene. It just is, it's not a healthy model. And we understand that the cost of practicing a model like that is differentially greater than if we apply prevention models.
Did you hear her? She said one of the fundamental tenets is prevention. You know what she's talking about. She wants to go into schools and she wants to screen children for gender dysphoria so she can start medically treating them at younger and younger ages. Not providing them with mental health intervention, providing them with medical treatments that will force their bodies to go through a puberty that is not natural for their sex, to force their body to develop sex characteristics of the opposite gender. She wants to do this as a preventative measure rather than acknowledge that this is a mental health issue. She wants to do this as a screening. She wants to screen children to find out if they're gender dysphoric so she can give them cross-gender hormones. Who is this woman, and why is our government giving her money to do research on children?
There are going to be people who are going to retransition, and we don't necessarily have to be afraid of that. I think that we need to honor people's capacity to adjust and move forward and move sideways and move backwards, and all of that is really important.
So they actually have a new word for people like me who had gender dysphoria and presented as the opposite sex for a number of years and then had my dysphoria resolved. I'm not called a dyssister anymore, or even someone who detransitioned. I am now called a retransitioner. I'm retransitioning into my original gender. Now didn't they just get done saying that gender is innate? So how is it that there are people like me who transitioned and then retransition if gender is innate?
I think one of the mistakes that we make is we assume that assessment is a one-time thing that happens before someone starts care. But the truth is, like everything in medicine, assessment is an ongoing process. Every time somebody comes back to visit you for their medical follow-up, you're having a process of assessment with them as a medical provider.
Every time a person takes a pill or puts a needle in their body, they're doing their own assessment. Need I remind you that she's suggesting these treatments be done on 8-year-old children who are being told that they're born in the wrong body and that there's no other treatment. And that child is supposed to assess their treatment?
Every time a person either takes a pill or puts a needle in their body, they are doing their own process of assessment. Is this what I want to do? Do I want to move forward with this? Is it working for me?
She's talking about children here. She's suggesting that children have the capacity to make these big, heavy decisions, and then if they change their mind, that's okay, because we need to be flexible. While at the same time suggesting that gender is so innate and so inflexible that we should go into schools and start screening children to see if they have gender dysphoria so we can put them on cross-gender hormones. Once you put a child on cross-gender hormones, a child like me who had gender dysphoria, as my body started to change into a male body, I would suggest that it would be increasingly unlikely that I would ever determine the cause of my gender dysphoria. They keep comparing it to diabetes. Okay, when somebody has diabetes, we can tell if the treatment is working because we can test their blood. There's something quantifiable, there's something diagnosable, there's something empirical.
And so if we really break down what the fear is, and I think the fear is very real, we don't like being wrong, whatever that means.
Being wrong, whatever that means. She doesn't even know what it means because there's no way to measure any of this, because this isn't a medical condition, because there is no way to determine whether or not the treatment is working, because the treatment inherently isn't working because it's damaging the child's body and reaffirming the idea that they were born in the wrong body, which is an incredibly unhealthy idea for a child to have. This is the epitome of body shaming, to tell a child they were born in the wrong body.
We certainly want to have that certainty moving forward, but we don't have that certainty about anything in life, right? We start people, for example, on psychotropic medications, and we don't know if those are going to help people. We don't know if they're going to make people less anxious or less happy. We just know that, okay, well, it has worked for a lot of people.
Puberty blockers and hormones work for a lot of people. Well, you know what works for even more people? Nothing. Doing nothing and allowing that child to go through natural puberty. And if a child has serious gender dysphoria, have them go to a therapist to get some help to resolve those feelings of dysphoria. Let's not encourage those feelings of dysphoria and to say this works for some people. Well, you know what else works for some people? Alcohol. Should we give these kids alcohol to resolve their dysphoria? Because that does help some people. Maybe we'll give them some heroin, because heroin helps people who have dysphoria. Sounds good to me. It does help some people. We're basing giving children cross-gender hormones that will permanently damage their bodies based on the idea that this helps some people. Great.
Right? Just like blockers and hormones, they work for a lot of people. And so we go forward with that assumption. If it's not working, we stop, or we increase the dose, or we try a different medication. This happens all the time in medicine. We just apply a different level of scrutiny to gender work.
Psychotropic medication, which is used for people with mental health issues, that they check in with the patient to see how it's going, and then they change the medication based on how it's working. So suddenly we go from diabetes, which has a very clear treatment path and we can tell whether or not the treatment's working, to psychotropic medications, which are used for mental health issues. But they're saying this isn't a mental health issue.
The benefit of being married to you is we have all these amazing, wonderful things.
In case you don't know, Dr. Johana Kennedy Olson is married to the guy next to her, who happens to be a woman who has transitioned to being a male.
I just did my injection this morning, and I was like, oh, I could use that. I can say this. Like, this morning I made a decision. And then I was like, oh, she took it right out from underneath me there. But I think that I've had people who have transitioned and have come back and said, I need to do something different. And the reason why we don't use the desist or detransition language is that we can't actually detransition. That's not a thing. And possibly that very thing is what scares people, right? Is that people can retransition, people can continue to move in a new or different direction, but you can't move back, right? And I think that very thing is what feels scary to people. Like, you can't undo. If I were to stop taking testosterone, there are certain pieces of my physical body that would certainly change, and there's other pieces that certainly would not change.
And this is important. People who socially transition can detransition, and there aren't any secondary changes to their bodies. So I presented as a male for a number of years, and when I desisted, I didn't have permanent physical changes to my body that happen to children who are medically transitioned. So these children who are medically transitioned, if they decide that transitioning didn't resolve their dysphoria, they can stop taking the hormones. But those hormones will have created permanent physical changes. They're stuck with those changes for the rest of their lives.
What I have heard over and over is that there was no way that I could get to where I am right now, which is a deeper and more diverse and robust understanding of my gender, had I not been able to travel on the road to get here. And so we create a false paradigm around, well, regret implies that if we don't do something, you're going to prevent regrets. And that's actually not how that works. It's like you have to have access to something. Certainty is also a false paradigm. Many of us have done things in our lives that we felt pretty certain about, and then we arrived someplace and we were like, oops, like that did not, whether that's marriages or careers or moves or children, there's a whole host of things, right? And that's true, that gets to be true of trans people as well.
This is basically saying gender isn't innate, is not inherent, is flexible, and is changing, because the patients who have changed their treatment trajectory have said that they don't regret it because it allowed them to move forward in their journey of understanding their gender. Now, if this is happening to older children, how can we expect young children to have a firm understanding of what their gender is when gender is based on societal norms and social stereotypes? And these children, we expect, are empowered enough to assess their treatment after they're told they were born in the wrong body. What a diagnosis. So a doctor comes in and says, you have gender dysphoria, you were born in the wrong body, but that's okay. We have a treatment. We're going to make your body look like the opposite gender so that you feel better. What child is going to question a doctor? How many times do children say, you know what, doctor, I'm not sure if that's the right treatment option, especially because you never mentioned that if I don't do anything, the chances are my gender dysphoria will naturally resolve.
And helping them understand that medical intervention is not going to eradicate gender dysphoria, that is a lifelong thing.
Also want to note that when these children are given treatment options, they're not being told their gender dysphoria is likely to resolve. Their parents are not being told that their gender dysphoria is likely to be resolved if nothing is done. And I would suggest if these children get appropriate mental health treatment, the chance of their gender dysphoria resolving is really high. So these children not only are able to dictate their medical treatment, but they're not being told what other options there are. They're not even being told that there are other options. They're basically being told that you have this medical condition and this is the only treatment for it. But it turns out it's not actually a medical condition, and we don't have any way to measure whether or not the treatment's working. And the treatment is actually going to cause your body to be dysfunctional. And it may turn out that you don't like the treatment, in which case it turns out that you weren't really transgender. But gender's innate, so we're going to call you a retransitioner rather than a detransitioner, because we don't want to admit that this is a mental health issue.
So I think that gender dysphoria is a lifelong experience. And the reality is like, there's no amount of medical intervention that's going to make me not trans. And so I think it's important that we also talk about like just being trans, just that that incongruency that will always be there will produce distress and discomfort in a variety of sort of varying levels of severity throughout life. And so if the approach is like, we're going to cure gender dysphoria, I think that people are going to continue to be quite disappointed, whether it's the person experiencing themselves or the provider.
This person works with children who have gender dysphoria and their families, and just said that even though they transitioned from being female to male, they still have gender dysphoria. So guess what? This treatment that works for some people doesn't really even work for some people. The majority of people who transition still experience gender dysphoria.
These people need to be stopped, and we need to stop spending taxpayer dollars on their research.